Hey Super Mamas, it's Dr. Joy here and you are watching Delivering Joy MDTV. Welcome to Super Mama Sunday, where we talk about everything pregnancy, birth, and postpartum. Today, y'all, I want to be real transparent with you and I want to start a conversation about taking back birth. Yes, that's right, taking back birth. You know, I'll be really honest, over the last few years, I've been on a journey to really examine how I think about pregnancy, labor, birth, and the postpartum period, and how I think about pregnant people. You know, as a traditionally trained OBGYN, and traditionally trained just means I went to medical school and to residency, which is your first job out of medical school. And I was trained in, the American hospital system, the American medical system. And, I'm realizing now as I become a lady of a certain age that maybe some of the cultures in our medical systems and in our medical education systems don't necessarily teach us to serve people well. And I know that's a little bit of a touchy subject, but I want to talk about it. And particularly in my specialty in the field of OBGYN, I want to think about how I might contribute to some of the problems and issues that we see in our country. And so I hope that you will come along on this conversation with me and that you'll be active in the comments and tell me about your experiences and your thoughts about the things I'm going to share with you over the next few episodes of Super Mama Sunday. I want to talk to you about tips to take back birth. Birth does not belong to us as OBGYNs or as midwives. Birth belongs to birthing people. So make sure you keep watching and that you come along for this deep conversation. All right, Super Mamas. So like I said, as a traditionally trained OBGYN, there were so many things that I was taught. And don't get me wrong, I don't think that anyone maliciously meant to mislead me into thinking something wrong or bad. But I do think that there were a lot of attitudes that were hardwired into the field of OBGYN that just do not serve women well. And when we think about the father of modern gynecology, I mean, my goodness, Dr. Marion is considered the father of modern gynecology. He experimented on enslaved Black women without anesthesia and performed surgery on them. He created these metal devices to explore the vagina and were these tools helpful in some manner? Yes, they were, but were they the best option? Maybe not. So I think we have to start to think about how did we actually get to where we are in this field, and who decided that these things were right? Who decided how we manage folks that we're taking care of? Who decided how we manage pregnancy, labor, and birth, or the fourth trimester, which is what we're calling the postpartum period? And is it right? That's kind of been a personal thing that I've been dealing with over the past few years is, why do I do what I do? Is it because there is scientific evidence to back it up? Or is it because somebody told me that's what I should be doing? Or is it because I saw someone do that? So it's really important for me on my personal professional journey for me to really examine that. And I think it's also important for me to recognize that I don't own anybody's body. So I can't make people do things that they don't want to do with their bodies or to their bodies. I can't make them put things they don't want to put in their bodies. And that I should not violate people's bodies. So that's been something that I've really been paying a lot closer attention to. And then two, I think that I have to own the fact that there have been things that I've been taught to do or to say or to think that may not necessarily be serving people well. So it's been more of a journey of discovery. So I've been able to join some really cool groups on social media and hear from lots of moms and people who are pregnant or who have birthed or planning to birth. And it's really been eye-opening. You know, it's been, I don't know, y'all, I've been a little bit in my feelings because it seems like some folks are to the point where they really hate OBGYNs, you know, or people who are involved in their care in the hospital, even midwives. I see all kinds of stories that just are so heartbreaking about the way people are treated at their prenatal appointments, when they go into the hospital for emergencies or for their birth, what happens to them postpartum, and it really just, I don't know, it makes my heart hurt. Like, I did not spend so much time of my life, 13 years after high school, training to go into OBGYN, to become someone that then disrespects and disregards and fails to serve women well. I don't want to be that person. So I think that's really what prompted me to go on this journey, to really understand what it is that women need. And I think to do that, you got to listen to women. And one of the things that I think that happens in our medical training is that we're told to collect a few pieces of information and then spit out a diagnosis and a treatment plan. And we think that, you know, we should be able to do this without necessarily working together with the patient. You know, and I think that that is the leftovers from what we call paternalistic medicine, basically like treating somebody like you're their daddy, you know, like, oh, I see what's wrong with you, you do this. And I think that that's kind of the way that medicine evolved in well, all over the world, really. But I think that type of medicine has got to come to an end. And I think that the remnants of it need to die. And now people have access to so much more information. So we got to be starting to use that information so that we can learn about our bodies, so that we can learn about the different conditions that affect us, and then we can be a part of our treatment team. So I don't want to make this a super long, drawn out video, but I really do want to have a for real conversation about this. And I want you to comment below about your experiences with your OBGYN care. And I want to start to give you some tools and tips on how to own your birth and how to take that back, because we don't own birth. The medical community doesn't own birth. Birthing people own birth. And in order to take that ownership back, there are a few things that all of us are going to have to do as a community. And I want to talk about the first one of those things. And so over the next 5 episodes, we're going to be talking about 5 different things that you need to know to take back your birth. So the first thing that you need to know is that you must take the responsibility to learn all you can. Knowledge is power. And so if you really want to have ownership and you really want to take back your power, then you got to know some things. So really taking the time to delve into the process of pregnancy, the process of labor, the process of birth, and the postpartum period is really important. I'm going to be linking down in the description box some really great links. In the description box, you will find lots of homework that you can look into. There are books that you can read, like What to Expect When You're Expecting is like a classic book. There are also online courses that you can take that can educate you about pregnancy. There are all kinds of reliable apps that are out there. The American Pregnancy Association is one, whattoexpects.org. There are so many places where you can get lots of great information. I'm also going to link my playlist of videos that I've made and that other people have made on pregnancy and birth education down in the description box below so that you can check these out. Knowledge is power. Arm yourself with as much knowledge as you possibly can so that you can own your pregnancy, your birth, and your postpartum course. I highly recommend taking a class if you can. Childbirth education courses, the Lamaze courses, the Bradley method. There are just so many courses that are out there, and I'm going to put some links in the description box below. And I really encourage you to check these out. If you're on a budget and you feel like, hey, it's too expensive, can't afford that, that's okay. There are lots of free courses and lots of reliable, reputable folks who are putting out education on YouTube that you can check out. So make sure that you are doing your due diligence to really arm yourself with knowledge so that you can take back your power. Arming yourself with knowledge helps you know what questions you should ask. It helps you be informed about your options and be able to fully discuss those with your care team. It also helps to decrease anxiety because when you know more about the process, you're not so worried about every little twinge of pain, or you're not so afraid about the birthing process that you're just freaked out the entire time that you're going through labor. So I think that first step in really owning your pregnancy, your labor, and your birth is starting to pay attention to all of the resources that are out there to educate yourself. And like I always say, if you're not preventing pregnancy, then you're planning for pregnancy. And it's so good to really start thinking about your reproductive life plan. So thinking ahead about when I want to get pregnant, how many kids I want to have, how far apart do I want my children to be. Setting these plans up help you plan in advance so that you know about making sure that you're having good nutrition, or you're taking prenatal vitamins, and you are preparing your body, your mind, and your spirit for conception. So these are things that can be so helpful so that you are already in a healthy mind, body, soul state prior to even becoming pregnant. Knowledge is power. Know as much as you can even before you decide to become pregnant. And if you don't necessarily have that option, if you find out you're pregnant, because half of pregnancies are unplanned in the United States, then start right away. As soon as you learn that you're pregnant, arming yourself with reputable knowledge, right? So don't go crazy on Google. You want to find things that are actually reputable. And if you want lots of good information, click on that description box down below, because I'm giving it all out for you, honey. So I hope that this start of the conversation was useful to you. Make sure that you subscribe and turn on that notification bell so that you're ready for next week's continuation of this conversation. Make sure you comment below about your experiences. I can't wait to hear from you. I'll see you next Sunday, Super Mamas. Peace.